Welcome to our webinar, Building Resilience to Heat-Related Health Risks, the example of Ahmedabad, India, our fifth webinar of the series, organized in cooperation with the Climate and Development Knowledge Network, CDKN. My name is Evgenia Mitrolyu from the Resilient Cities team at the ICLE World Secretariat in Bonn, Germany, and I will be hosting this webinar today. First of all, I would like to inform you that we keep all participants muted for the duration of the session to minimize background noise. If you have a question or having technical difficulties, please send us a message in the question chat box. For those of you who don't know about us, ICLE Local Governments for Sustainability is an international membership organization for local governments around the world, with over 1,000 members in 84 countries. We promote local action for global sustainability and support cities from our global, regional, and country offices with targeted programs and events. Every year, ICLE convenes the annual Global Forum on Urban Resilience and Adaptation to Climate Change, widely known as the Resilient Cities Congress. This year, the Resilient Cities Congress will take place during the UNFCCC Climate Change Talks in Bonn. Our webinars focus on a selection of key themes presented by international experts, which bridge conversations initiated at the Congress last year with new ideas, directions, and innovations in the run-up to Resilient Cities 2015. In today's webinar, we will introduce a CDKN-supported project implemented in the city of Ahmedabad, located in the Gujarat state of Western India. An early warning system and a heat action plan were developed and effectively implemented as part of the project, which has been recognized both nationally and internationally for its success in tackling heat-related health risks. This webinar will focus on Ahmedabad's strategies and measures to prepare for heat waves and build public awareness on the associated risks. Efforts to roll out this pioneer model in other rapidly urbanizing cities preparing for extreme heat will be discussed. Today's agenda includes two presentations lasting approximately 30 minutes, followed by a 10 to 15-minute Q&A session. Anjali Jaiswal will give us an overview of the project, indicate the enabling factors that led to its success, and discuss how aspects of the Ahmedabad's heat plan can be applied in other cities. Dr. Tejas Shah will then share his experience with the project, describe the planning process and strategies implemented in the city to reduce the impact of heat waves, elaborate on the effectiveness of the plan, and give us an insight into the next steps of the project. You can type in your questions during the presentations and we will read them out at the end of the session. When typing in your questions, please indicate which speaker you're addressing your question to, and if you like, the name of your organization. As previously mentioned, please also type in any questions related to technical issues so we can help you sort them out. To get things started, I would like to introduce Beto Shruti, who is a Program Coordinator and Sustainability Manager at the ICLE Regional Office in South Asia. Beto Shruti has more than 10 years of experience in the field of environment and program management and is currently managing several long-term international projects, including projects on environmental management systems for local governments. Today, she will introduce us to the general topic and importance of addressing heat-related health risks in cities. Shruti, I will hand it over to you now.
So, thank you, Virginia, for the introduction. I would like to I don't have a presentation with me, but I would like to just speak for 5 minutes about the climate change impacts related to heat stress that we are going to discuss in details and how, with a specific example of Ahmedabad. As we all know, rise in temperature is one of the most evident impacts of climate change, and the rise in temperature, of course, causes also heat-related health impacts, including increased morbidity and mortality. The rise in temperature in different regions are expected to be about 0.8 degrees to 2 degrees centigrade, and urbanization, which is a major issue right now, is actually exacerbating this problem. What it is resulting in is basically longer periods and more intense periods of heat or higher temperature durations, which is basically causing more illnesses and even deaths. There has been recorded heat waves in Europe causing a major loss of life. In India, of course, it is a rampant problem. Every year we face it. 2014 has recorded the longest period of heat wave, the longest duration. And in fact, it is recorded that from what was recorded in 10 years ago, the number of deaths that was occurring 10 years ago over the entire summer period is now occurring in only a few weeks. Some of the major health impacts of this kind of heat stress which we encounter are sunstroke, dehydration, fever, nausea, vomiting, heat cramps, and even death. And the people who are most likely to be impacted because of this heat stress are, of course, the elderly, the children, people who already have chronic diseases, so who are already suffering and who are already compromised with health issues. And of course the urban poor, because of their lifestyles, their greater exposure to heat. There are, of course, apart from the health impacts, there are socio-economic impacts. For instance, loss of productive days when schools close down, offices close down because of excessive heat. There are power outages. There is excessive demand leading to power outages. Urban heat island formation is another phenomenon which is on the rise, and urban planners would need to now actually tackle this issue effectively. There is also damage caused to crops and livestock. This is, of course, also related to the health impacts, but also causes economic impacts. Some of the measures that can be taken for tackling the heat stress due to climate change are mainly early warning systems and planning that can be provided at a regional level or even at a local level. So these can actually help people to plan ahead and avoid the heat. Avoiding the heat can also be done by wearing protective clothing, spending less time outdoors, keeping oneself dehydrated, and so on. So these are more individual efforts that people can take up. Keeping the home cool, using curtains, opening the windows in the night, keeping ventilation is important to keep the temperature controlled. And of course, public education regarding first aid for people who are actually impacted by heat, which can actually help people save lives. So I think this is a basic introduction that I wanted to give, and I will not take more time on this, but I would like to now go on to the actual presentations which will show what is being done at a local level and what can be done at a local level.
Thank you, Bedashruti, for this excellent introduction. Thank you. Now allow me to introduce our first presenter, Anjali, who is a senior attorney and founding director of NRDC's India Initiative on Climate Change and Clean Energy. In leading the India Initiative, she collaborates with local partners to advance projects on community climate change adaptation, energy efficiency in buildings and appliances, and renewable energy sources. Before founding the India Initiative in 2009, Anjali was member of the NRDC's litigation team in San Francisco, leading cases for strong appliance efficiency standards and wilderness protection. Before moving to San Francisco, Anjali worked on healthy water quality as part of the NRDC's Los Angeles program. Today, Anjali will share her experience with Ahmedabad's Heat Action Plan, present the main outcomes of the assessment of the plan's effectiveness, and discuss initial attempts of scaling up and scaling out the project to other cities across India. Anjali, I'll hand it over to you now.
Wonderful. Thanks so much for having me here. Can you all see my screen?
Yes.
Wonderful. Well, I just wanted to thank ICLEI and Resilient Cities, CDCAN, Avina. Thank you so much for organizing this and having us all here, the co-panelists, and of course the attendees, because as we know, and President Obama recently said this in his State of the Union speech, and Prime Minister Modi also emphasized it again just this month, on how urgent and pressing our need to fight climate change is. Climate change is bearing down on our communities around the world. And early warning systems, like the Ahmedabad Heat Action Plan, is a way to protect our communities and fight climate change. So I have a list of 6 items here from ICLEI on the presentation that I will discuss and then leave it open for questions. And of course, we have the honor of having Dr. Tejas here from the Ahmedabad Municipal Corporation who will follow the presentation and give more details. So just an overview, the Ahmedabad Heat Action Plan is the first comprehensive early warning system and preparedness plan in South Asia. It uses 3 key strategies. They're very simple, and many cities can adopt these. They are easy, low-hanging fruit strategies to protect communities, to protect the elderly, children, the most vulnerable, outdoor workers. So what are the strategies? First, public awareness, meaning communication, outreach to the citizens on communities, how to protect yourself from extreme heat. Second, an early warning system, a system that lets the citizens know it is going to be hot, the temperatures are rising. They are a deadly threat. And third, increasing the capacity of the healthcare professionals, not only the doctors, but also the link workers, the workers that go and give the shots, the vaccines that go into the slum communities so that they can arm the citizens, arm the community with messages that we heard earlier from Ms. Bendoshi to make sure to stay hydrated, to make sure to stay out of the sun. Those are the 3 simple key strategies that ones we highlight. Here is a visual of the Heat Action Plan and some of our activities that Dr. Tejas can discuss that you'll hear about. On the on the right of your screen is the forecasting system that lets you know when it's going to be an orange day or a yellow day or a red day that Dr. Tejas then notifies the city. But also what we have going on before the heat season, after, and often throughout the year, or what you see on the bottom are many of our workshops and planning meetings. Sensitization meetings that lets citizens and communities engaging them, getting information. There's Dr. Abhyant from our team as well, and Dr. Sheffield doing focus groups and understanding what's happening with the heat season. We also have lots of campaigns and ads, as you can see the bus with the flyers with the AMC. In Gujarati, we have advertisements and hoardings throughout the city, as well as pamphlets distributed to school children. So now I'm going to talk a little bit about why the science is important here. And as we heard from Ms. Shruti earlier, that 2014 was the hottest year on record. And what we're seeing is temperatures rise across the globe. What that means in India and South Asia is sometimes what we hear from people is, well, isn't India already hot? I mean, Ahmedabad, Gujarat, it must be really hot for those attendees that have been there. But what we're seeing is susceptibility and the body's ability to respond to heat, even to people that have been exposed to heat for a long time. In 2015, and in this day and age, no one should be dying from heat waves. They are very treatable if they're caught early. They are very preventable. And I'm not a physician or a doctor, Dr. Tejas is, but he can talk about how preventable they are, and these early warning systems really allow us to do that. But getting back to how did we create this plan? So we started with the science, and we started first with understanding what's happening in the situation. So here are some news articles from 2013, and again, we have them from 2010. What we saw in Ahmedabad was a heat wave where temperatures rise to 44 degrees Celsius, 45 degrees in 2010, where the hospital rooms were inundated with infants and really people unable to cope with the heat. And the AMC came to us, we found them through our scoping exercise of cities to say, yes, we want to work on heat. So we started with a kickoff workshop. This is the next slide that we have. And we brought together scientists from throughout India and some international scientists as well. And we examined heat waves and created a roadmap to creating the Heat Action Plan. It was a partnership that involves Emory University, Mount Sinai University, Georgia Tech. We had people from Arizona as well as New York and California. It was a U.S., it was an Indo-U.S. scientific workshop, so we were limited to participants from the U.S. as far as our international expertise there. However, we've examined plans in Australia, Abu Dhabi, China, Europe as well, of course, and North America. And so we did several surveys and examined 4 key actors: the municipal government and how the municipal government's communications and operations work, how the departments speak to each other. We had several focus groups with physicians, doctors, link workers, the urban health centers as medical providers. Then we did 2 surveys that we went into the communities. We did a slum community survey with extensive members of 10 of the slums in Ahmedabad, understanding exposure, communication, as well as to high-risk occupations, outdoor workers, construction workers, examining, and something that we'll be examining more, the gender dimension on how women and men are affected by heat, as well as the children and elderly. So we have several policy papers and briefs, and now we have 4 published journal articles as well, which I don't think they're in the PowerPoint, but I can send them along that have been published, and we're working on more manuscripts. In addition to the science in the issue briefs for the policymakers as well as the journal articles, this next slide shows we did some media outreach, and the media is interested in heat. So in cities and communities, the reporters are a big part of the outreach in and of themselves, of writing about them in the paper along with the ads. We have blogs that we do. The Center for Science and Environment in India did an article in Down to Earth blogs. So we've done a lot of media outreach, and they are a very important role in protecting lives. So the next questions were, what are the enabling factors? Well, we had this strong scientific base. We had the 2010 heat wave, which was a wake-up call, and we had leadership from the AMC. And I really can't say this enough, the Ahmedabad Municipal Corporation, and of course, you know, I should have said this on the outset, our tremendous partner, the Indian Institute of Public Health, Gandhinagar, led by Dr. Dilip Mavlankar. So with that partnership and the international partnership, we've really been able to focus on heat waves. Here's a quote from the commissioner on heat waves and how the HAP is replicable as well. And the interventions, even though they're adopted for Ahmedabad, they can be easily adopted for other cities. And then also some components of the heat action plan that the AMC took leadership on in terms of the formal communication. Dr. Shah is the nodal officer, capacity building, lots of trainings and activities, community outreach and education that we will ramp up when we release the 2015 heat action plan. Then one of the next questions are, what are the outcomes of an evaluation? We are with the Indian Institute of Public Health, Gandhinagar, and the AMC, we are evaluating how did we do. We did an evaluation for the 2013 plan and for the 2014 plan. So overall, we found that Ahmedabad is much more prepared for heat waves than it was in 2010. That the AMC and especially the nodal agency within the health department has been successful. We saw fewer reported all-cause mortality deaths during the hottest months. We saw accurate temperatures and forecast alerts. We spend a lot of time thinking about the threshold and when and how to call the early warning system, which Dr. Tejas does a very effective job of. And then also the strong potential to increase effectiveness and reach vulnerable populations. I think this is going to be a big focus for us this year, is really reaching more of the slum communities, reaching the elderly, people that aren't looking at these fancy screens that we have and don't have access to them, that don't have access to air conditioning, really getting out the preparedness and awareness information. We'll be doing a new survey in the coming month on how to improve that in the next year. Again, I've started looking ahead already. So we are exploring a few other cities in India and working with them, starting with the evidence-based partners and strong city government, the 3 components that we'll be looking for. And we're also, of course, working with the Gujarat state level, scaling the program to the state of Gujarat in western India, where Ahmedabad is located, as well as the national disaster level agencies as well. So preparedness that NDMA and other agencies and coordination groups do in India. So I think that is all the questions that we've had there. And this is a picture of our team so that you can see us together with, this is Commissioner Mohapatra, who just recently is now in Delhi, and there's a new commissioner there. So thank you very much.
Thank you, Anjali. This was very comprehensive. Thank you very much. I would like to give a reminder to all attendees that you may type in any questions you have for the presenters during their presentations, and we will read them out at the end. We would like to now move to our second speaker, Dr. Teja Shah, who is the Deputy Health Officer for the Ahmedabad Municipal Corporation. Presently, he also serves as the Nodal Officer for the Ahmedabad Heat Action Plan. Dr. Shah has presented the Ahmedabad Climate and Heat Action Group, consisting of expert non-governmental and academic groups, including the Indian Institute of Public Health and the NRDC, at various international forums, including the Resilient Cities Congress. Dr. Shah has co-authored research papers on the evidence-based case for policy action in the city of Ahmedabad. Today, he will describe the planning process as well as measures taken to prepare local communities for extreme heat events, focus on the role of the health department in coordinating the city public health efforts, and share with us the envisioned next steps for the project. Dr. Shah, please go ahead when you're ready.
Good evening, everybody. Myself, Dr. Teja Shah. As Anjali has narrated very well, that President Obama and Prime Minister Narendra Modi was very much concerned about climate change and its effects. And I'm very fortunate that I belong to the town which is the hometown of our Prime Minister, Ahmedabad. And Ahmedabad is the first city to adopt this heat action plan in Southeast Asia region. And as Anjali told, that I am asked to speak about mainly 6 topics. The first of it is describing the planning process and the strategies and measures for preparing local communities for extreme heat. And for that, what leads to development of this heat action plan. Ahmedabad had its worst and alarming heat wave experience in May 2010. And as an administrator, the first and foremost important thing is the health of the citizen is mostly required. Ahmedabad had more than 1,300 deaths in the month of May 2010. So it was a very worrying point at that point of time. And each and every stakeholder was thinking that something should be done to prevent this. Everybody, the bureaucrats as well as the political body, was willing to do something very nice for their citizens, how they can prevent their citizens from the effects of devastating heat wave. So for that, as you all know, in 2011 Vibrant Gujarat Summit, AMC has entered into the MOUs with Public Health Foundation of India and IAPHG and NRDC to build evidences and make recommendations that are tailor-made to address heat health vulnerabilities. For that, we have entered in that MOU, and participatory planning was required. That should be effective on helping the at-risk population and to address the concerns and budgetary concerns mainly, and the time constraints, which is the most important thing. Because if the budgetary concerns are levied too much heavily in any process or any project, then the future of the project, you can understand that it is very less. So we have developed such a planning that is compatible with our this budget. And as you can see, these are the certain some headlines which were there in newspapers, that over 50 people died already in heat wave. And when the MOU was done, some planning process was going on. Some newspapers has identified that some color bands to warn people about heat wave. Then the other thing is that to make the stakeholders aware about how this our project can help the citizens of, and without their understanding it was not possible to implement this project. So some scientific studies were required, and as Ajli had already narrated that they have done with the help of IAPH and NRDC, they have done some studies among the high-risk populations, some gender-specific studies, and there were some scientific policy issue briefs were available. So with that we were able to make the stakeholders and the political body understand that how this project is going to help in helping the citizens. So with this we have started this project in somewhere around 2012 in the March or so, and we have developed a heat action plan during 2012 and 13 and implemented it in 2013. For that we have some nodal agency was required. So with all discussions, health department was chosen as nodal agency, and myself I am very happy with you here that I am the nodal officer of this heat action plan, and we are working on it. The bureaucrats and this political body were ready to allow some budget as well for this our plan implementation. And after 2014 plan, once the scientific basis were turned into some results, their willingness and ownership are right now it is much more among top leaders, and it has played a major role in successful implementation. We had also trained our medical officer, health workforce for this all. Now for heat action plan implementation, interagency coordination was most important, because it is not only the health department who can implement effectively this heat action plan. So certain agencies also required to be focused on. So first and foremost, most important part was media. We do have this alert system, early warning system with Georgia Tech, with collaboration of Georgia Tech University. With this, with help of this university, we are getting information 7 days in advance that what is coming, and with the help of press and media, we were able to transmit this information to the people who are going to be affected by this heat wave. And then certain departments such as hospital department, they have to be ready for the emergencies which are going to be come in the coming days. Then labor department, then our water department, then electricity department, transportation department, and our schools, parks, zoo, all are informed, and the coordination with them helped us in implementing this heat action plan. And some non-governmental groups such as PHFI, IAPH, 108, that is an ambulance service, emergency ambulance service, all help us a lot in implementing this project. And we do have a meeting with our top bureaucrats with in coordination with political bodies to all the stakeholders, and we have sensitized all of them, and that help us in implementing this project to its highest level. So in the next slide we can see the actual effects of our project, which is the most important part. As you can see, in 2010 when we had thought of this plan, and these are the various effects of this heat action plan. You can see the temperature temperature days, which I had shown in the red line, the number of high temperature days were less in compared to 2014, even though the number of cases rose to very high level and the number of reported deaths were also high during that specific period. When compared to 2010, in 2014 the number of deaths were more, the duration of a high temperature was very high, even though the number of cases and deaths were very less. So with the implementation of this project, we were able to reduce the number of deaths to very less. So that is the first success of this heat action plan. And I'm very happy to say at this point of time that due to this plan, our Georgia Tech University predictions were so perfect that our predictions helped us to say that up in our media people were writing like that in the next coming 7 days AMC's predictions are like this, and they were comparing it with IMD predictions as well. And I'm happy to say at this point of time that our predictions were far more correct. Now the next is, as Anjali said, I don't want to say anything much more about this. Replicating and learning urban heat action plan for some other cities. So this NRDC and IAPH are working on that, and our heat action plan efforts got very well recognized, appreciated and recommended by former Honorable Minister of Health and Family Welfare, Government of India, Dr. Harshvardhan. Now the focus points for 2015 heat action plan. Our focus, as I have already said, that we will do much more on something for improving IEC activities and training, improving our outreach in vulnerable communities. Some new media initiatives will be taken, such as local languages, SMS, social media broadcast, etc. And now increasing IEC activities at service provider level in hospitals must be done, and we will focusing on that. So then we will ensure essential medicine and services are properly delivered during the heat wave, that is hospital equipment and some drinking water and shaded areas. And we will also work on interagency communication as well. Thank you.
Thank you very much, Dr. Shah, for this very interesting presentation. We will now move on to a brief Q&A session with the questions we have gathered so far. So the first question comes from Mona Ludigkeit, who is asking, she's interested to know whether this heat-related disease is related to the air quality in the city. Is this taken into account? And do the health department work together with the environment department on this aspect? The question comes, I guess, to Dr. Teja Shah. Dr. Shah?
We are working with engineering department as well. At this point of time, the air quality has not been taken in consideration. Right now we are working on our predictions only, but we are definitely working with this environmental issue, and we are in talk with our Gujarat Pollution Control Board for air quality effects on actual heat. So that is taken in consideration, and we will work on that.
Okay, thank you very much. Another question from Jyotiraj Patra is directed again to Dr. Shah. She is asking, what are some of the major challenges encountered by the Ahmedabad Municipal Corporation for successful integration of the heat action plan to the overall disaster management plans at various levels, such as city, district, state, and national?
Good evening, ma'am. I'm working in Ahmedabad Municipal Corporation. So we do have some different disaster management plan. So our National Disaster Management Authority and the State Disaster Management Authority had also taken this heat action plan in state heat action plan as well. They have developed this state heat action plan as well. Now they have considered heat wave as a disaster. Earlier it was not considered as a disaster. After the implementation of this heat action plan, they have considered this as a one of the disaster. So our state government, we are a such statutory body. So state government has taken this into consideration, and now onwards we will be supported from state government as well for the implementation of this project.
Okay, thank you very much. A question towards Anjali now from Alice Ryle, who is asking, how are you going about bringing the concept of the heat action plan to other Indian cities? How have your efforts been conceived by other local governments?
Thank you for that question. We have developed a matrix with several factors and several cities in India. When we released the heat action plan in 2013, several city governments contacted us. We work on a heat action plan here. So our three primary factors that we're examining first, the matrix has several factors across the top, from the evidence base, the Met department there, the weather, the urgency. The number one factor is someone like Dr. Tejas Shah, like a city government ready to work with us. Not just an individual, while Dr. Tejas is great, but we're in Ahmedabad, it's not just Dr. Tejas that supports the heat action plan. It goes all the way up to the commissioner and the mayor, as well as to the urban health centers and the medical officers that are in the community. So it's this widespread community support in the government, as well as GVK, the media. So building that support and seeing leadership there, as well as a local partner. There's so where there might be another IIPH, and of course the temperatures. You know, the temperatures are important in how heat waves affect in the evidence base. But as we work in South Asia, we were examining one coastal city, and they said, "Oh well, does a coastal city have heat waves?" And Dr. Knowlton said, "Yes. New York City is a coastal city, and it has heat waves." You know, when they're preparing early warning systems in Europe and France, and the French heat wave, that really was a wake-up call for the world. The European one in the early 2000s, as well as Canada. So we have many interested cities, and we're first having initial discussions with the partners and the evidence base, and then meeting the city governments. And I also just wanted to quickly add on the air quality question and environmental question. The heat action plan that most of us see is the easy read version, which is a shorter version that highlights the top 3 immediate strategies. The actual heat action plan document that we have prepared is an 80-page document that goes much further, that examines air quality, and we have explored that. We haven't written any scientific papers about it. There is a very negative synergistic effect between heat and air quality that's being studied in Gujarat and other parts of India. The other part that's really important is cool roofs, heat island effect, and city infrastructure. I know in this ICLEI call in cities, that's a very important topic on urban development. And just a quick story, what we were able to do is the Shardaben Hospital, which is the main slum community hospital in Ahmedabad. In 2010, that hospital had a black tar roof. The infant ward was on the top floor, the neonate ward. And in 2010, they saw mortality and morbidity with infants, basically many sick infants from the heat. And what the commissioner and the hospital superintendent did was they put on they changed the roof to a white China mosaic roof, and they moved the neonate ward down to the ground floor where it was much cooler. And those are low-cost measures that cities can put into place. They put in a smaller ICU air conditioning unit, and they have revamped 8 of the urban health centers with cool roofs too. So that's a way to just provide cooling that goes together. And recently, we also understand that Ahmedabad is moving forward with putting solar panels on hospitals and some of the cities to provide energy during some of the peak season and peak load as well as throughout the year. So development is a big part of heat as well. Thank you.
Thank you, Anjali, for commenting about the air quality. We had follow-up questions on that, so that clarified, I think, some of the questions. Thank you very much. We have another question from Carl Philip Schuck from GIZ Cairo in Egypt, who I guess the question is directed to both Anjali and Dr. Shah. It is which data is being used to keep information up to date with regards to temperatures, local measurements versus national weather forecast, and mortality rate? And at which point or threshold are citizens being informed about the upcoming heat wave? Either Anjali or Dr. Shah could start responding.
I'll start, and then Dr. Tejas, I'll turn it over to you. Is that okay?
Yes.
Great. So the temperatures are really the same set of temperatures. There's the Ahmedabad weather station, which is near the airport, which collects the data. And that data is really part of the Met Department, is a big part of this project, and the Met Department and their forecasts that they do. That temperature data is shared through international websites like NOAA and elsewhere. And that data is available to the ANC, and it's part of our MOU that we have with IIPH. We also, so we have the Indian government Met Department data, which is now a 5-day forecast. It used to be 2 days, and they've moved to a 5-day forecast for heat. And then we also have been working a lot on forecasts, not we, but the scientific community at large, on probabilistic forecasts that are very robust, that are able to predict weather up to 2 weeks out, these innovative forecast systems. And so Ahmedabad and the commissioner and the health department were interested in having a companion complementary forecasting system to have the two of them work together. So you have the IMD forecast working with the one that's produced by Georgia Tech and CFAN, and I'm not a meteorologist, so I won't explain it as well, but a very robust forecasting system. That Dr. Tejas then compares both the IMD data as well as the Georgia Tech one and looks at them together in terms of accuracy. We also determined what the thresholds are for predicting a heat wave, and Dr. Tejas can talk about those thresholds. For the mortality and morbidity, data is a challenge. I know that this question is coming from Cairo, and having only been there a few times and not working on the science, but in India, data can be a challenge. So what we were able to do through our MOUs and really working with physicians is get the mortality data from the hospitals, and what we're trying to do is work on the case definition of the hospitals and reporting, and get more reporting done in India. But we were able to get the daily death counts from the city and from the hospital that helped us measure where we are each year and develop a baseline. So Dr. Tejas, maybe you could talk about the temperatures for the threshold and how the forecasting is working.
Yeah. What we have done is we are receiving data from Georgia Tech University every day during our peak season, that is between April and July. And for Ahmedabad, the temperature below 41 degrees centigrade is usual during the months of summer. So we have divided the temperature thresholds into 3 different color codes. When the temperature is between 41 to 42.9 degrees centigrade, that is 41 to 43 degrees centigrade, we have color coded into yellow. Then between 43 to 44.5 degrees centigrade, we are considering it is a very hot day. And when the temperature supposed to cross 45 degrees, then we are considering it as extreme heat day. So once we are getting data from Georgia Tech University and CFAN, so if the temperature is going to be above 43 degrees centigrade, then at that particular point of time we are deciding that right now we have to issue an alert through various mediums. We are using various mediums such as print media, electronic media, social medias. These are the various ways by which we are spreading the message. The deaths are starting to occur once the temperature goes beyond 45 degrees, which is based on our experience in 2010. The other thing is that what I want to share is the data, the hospital data is really challenged. Right now, they are not very keen to provide data regularly. But what we have taken as a base is our Ahmedabad Municipal Corporation has a very good registration system through our Registrar of Birth and Death. So for understanding every day on an average during the months of summer, the number of deaths are somewhere around 100 to 110. So without any reason, any communicable disease in this peak period, suppose the temperature has been gone to beyond 45 degrees centigrade and there is no any other reason to rise in mortality, and that's what happened in 2010. There was no other reason, and in a single day the number of deaths were somewhere around 300. So directly on or indirectly, the heat effects has led to number of deaths which has the toll which has been risen. So this is the base which we had taken, and now onwards the hospitals are also starting to share the data. Thank you.
Thank you. We have time for one last question, and this time the question comes from Agat Kavikioli. She is asking what kind of efforts were taken to include heat-vulnerable stakeholders to the planning and implementation phase of the project, meaning the children, the elderly, residents of slum communities, or outdoor workers. That question is directed to Anjali. Anjali, are you with us? Hello?
Can you hear me? Hi.
Yes.
Hello? Can
Yes.
you hear me?
We can hear you, yes.
Sorry. That was one of the main focus. So one of our first activities after the Kickoff Workshop was the surveys we did. And, you know, one of our main partners for this project is CDKN, which really is part of the philosophy that this project has of science and action, you know, applied science. So we did extensive summer survey of some slum communities and wards in Ahmedabad, representing with the head of the household, which is usually the mother in the household, with a survey instrument examining how, really, it's the first survey that's been done. Like, how do you know when there's a heat wave? What do you do? What is the communication strategy? And we have a published journal article on that, so we can share the link. And at the end of my presentation, there's a document called the CDKN Inside Story that tells you how we went about the heat action plan that we put together. Dr. Tejas and I, along with Dr. Mavlunkar and Dr. Knowlton and our team, wrote that with CDKN. And then on that page, it has a link to the article. So it has both the scientific as well as the policy, depending on the audience. Similarly, for construction workers as well, we also did another survey and instrument and analyzed how outdoor workers are affected. So what does this mean? I mean, like, we did all the science. So how does it apply? And Dr. Tejas can talk about this too. That's why, you know, the communication and messaging around it is really important. The link workers, who are, for those of you not in India or in Ahmedabad, are really the medical officers that go into the community and interface with the community, as well as providing water stations at temples, at mandirs, and other locations is really important to reaching more of the population. The language and the media, like using the local station Radio Mirchi, for example, or how communication is happening, text messages or SMS or WhatsApp through the simpler data devices as a way to communicate, the hoarding, as well as just understanding. I mean, I think one of the stories that was really illuminating for us is when we were doing the slum community survey, we asked an elderly gentleman there, you know, well, how do you know when it's really hot? How do you know there's a heat wave coming? And he said, well, usually when I'm hot, I usually go and sit under that tree or in this tree. And I don't know if any of you have ever been like in a heat wave or in this, but I've tried it. And when you go and you sit under a tree or near a tree or on a tree when it's really hot, you really get some relief. It is much cooler. But what he said is, when I go sit in that tree and I get no relief, that's when I know that it's really hot. And so that was you know, for us, a real challenge, because it's like, okay, I mean, of course that promotes tree cover, which we want to see in many of our cities around the world, but also it's like, how do we reach, you know, people that really, you know, it wasn't the newspaper, it wasn't, you know, temperature gauges, it wasn't the radio, his neighbor. So really engaging and enabling a community system, an early warning system that uses all those messages. For those of us who've traveled, you know, and seen the temperature gauges in the West, Ahmedabad's put up several temperature gauges, starting to get people to understand 45 degrees is dangerous to your health and what that means, what those temperatures mean. So while the program's been really effective and they're easy measures, the communication outreach part to get to the most vulnerable communities and putting that science into place is something that we're working on as well. So thank you for that question.
Thank you. As we have come to the end of our time, I would like to conclude our webinar and give a warm thank you to Vidusruti, Anjali, and Dr. Shah for sharing their experience with us today and giving us thorough overview and insight into a successful and pioneer approach to tackle the serious issue of heat-related health risks, and to all of you for attending and engaging with us in the discussion. We have been recording the webinar, and it will be made available on our Resilient Cities series website shortly, together with the presentations and CDKN resources for further reading. There you can also check the past webinar recordings and download relevant material. I would like to take this opportunity to bring to your attention that our Resilient Cities Asia Pacific Congress, the first ever Asia Pacific Forum on Urban Resilience and Adaptation to Climate Change, is taking place next week in Bangkok and welcomes all related and interested parties to attend. For more information and to register, please visit resilientcitiesasiapacific.iclei.org. With that, I would like to conclude our webinar. Thank you all for joining us, and have a good day or relaxing evening.